No, I mean, so talk us through the funding cycle. I think that was a
Yeah,
final
sorry,
part
second
of
part of the
Jeff's
question.
question. Yeah.
So we did a seed round in October of 2017. It was oversubscribed in 2 weeks. Um, Basically, I asked my two partners if I could go back to the people who supported me in Medivation and Biohaven and Portage. And I said, just for friends and family. Apparently, I have more friends and family than I knew. So
Yeah.
as we wanted to raise five, and we had 10, and then finally I said to Jim, I'm not going to take this dilution. So he and I wrote $1 million checks to participate in that round. 6 months later, we had 7 projects. It was just 2 of us working at the time, full time, Alex and I. And basically, we needed money. And so we went out to raise $50 million in a Series A at a $200 million pre with downside protection. And what happened at that point in time was we sold out in 4 weeks, oversubscribed $53 million, mainly ultra high net worth because we didn't have the luxury of going after, institutional investors because I needed the money before the summer and it was the end of May. And they take 4 to 6 months, as you know, to do financings, and I don't like VCs. We ended up doing the ultra high net worth, and we had Foresight, a very sophisticated biotech group, an insurance company, a generalist fund, and that was that round. In the fall, we had another 8 projects, so we needed more money. So we had to raise $50 million again. And so we did a $100 million Series B round at a $400 million pre. And basically, that was oversubscribed at 104 million. The first $50 million came in very quickly, which was what we needed. And then we had luxury of going after sovereign wealth funds in the second portion of that.
And so Greg, and you're doing a raise currently, and how much money are you raising now? And if you're allowed to share, what valuation approximately would that be?
Yeah, so we're in the midst of raising a $250 million, $150 million of equity, and a $100 million convertible bond, which bears interest at 3% for 2 years, 4% in year 3. And if we go public, they can convert at a 20% premium to the IPO price, which we plan to do in the next 8 to 12 months, markets willing, go public. And $150 million is Series C, and it will convert at a 50% discount to the IPO, but it has a floor of 850 million. So if we're able to go public at 2 billion, they will, get a double, to get 100% return. And if it goes public at $1 billion, then they will actually be diminished to 700 million to get a 50% return.
What an interesting little structure to put it in there. Makes it very, very interesting, not so boring. So Greg, tell us, how are you using artificial intelligence for formulation of your products, the Juvenescence line of products? By the way, how many SKUs are there in the line of Juvenescence products? And how are you using artificial intelligence to do the formulation for the products?
We took a hard look at it and working with a number of groups. We have in silico medicine, which is very good at chemistry, machine learning, and we invested in them, and they helped us find a product. It should have taken 2 years to discover a drug candidate. They came up with potential candidates in 45 days. Machine learning is outstanding at chemistry. It's rubbish at biology. Biology is chaos theory, and we don't have the computing power yet to do that. When we get quantum computing, at that point, that will be an enormous transition in the world of drug discovery. Machine learning is also very good at drug development, and there's a company named Netromark out of Canada that we started working with for that, to try and find specific populations. So instead of having to run a clinical trial with 100 patients, you can run a clinical trial with 50 patients where you know they are the optimum population. It's interesting to me how many clinical trials failed because they had the wrong population. It would have worked brilliantly if you'd only done it on a certain population. We're seeing that with the discrepancy between genders. Some drugs will work better in men than women. Some drugs will work better in Asians than Caucasians. So it's very good at that. What we've done is we've created a division under Charlie Roberts, who's done an amazing job building a team of the Turing Award winner of 2018, two of the top people in the world for graph convolutional networks, which is this form of machine learning that's the backbone of Pinterest at Twitter and one of the foundational forms of machine learning at Google DeepMind. But nobody was using it to do drug combination and repurpose drugs. We think this is an extraordinary opportunity to use machine learning for that sort of opportunity. So metformin is for type 2 diabetes, but it seems to have this remarkable effect as far as modifying aging. How many other metformins are there out there that we're unaware of that would have an amazing role in anti-aging? And so we think that the graph convolutional networks will be an extraordinary opportunity to find that. And happily, the Gates Foundation feels that we are best in class. So they've given us a grant, and we'll turn over their COVID data so that we can try and find drug combinations and repurpose drugs for COVID. Just found out that about a week ago.
That's great. That's fantastic news.
Yeah, really exciting for the team.